Chrissy, thank you. Well, heart disease is the leading cause of death among adults in the U.S., but now experts are looking at kids' heart health. Pediatrician Jamie Friedman joins us to talk about this conversation, and really interesting because I think as we look into our health as we age, you start checking your blood pressure more, looking at your heart health, but it's very rare that we think about our kids in this way. What is this new study all about? What is it saying?
Well, it's not new information, it's new guidelines as far as which blood pressure for kids is a concern. So we know that when kids have high blood pressure, they go on to become adults who have high blood pressure. And we know when adults have high blood pressure, there's a higher risk of heart disease and stroke and kidney disease. These are things that we want to prevent even at a very young age. And so now we have newer guidelines that tell us which blood pressure we need to be concerned about and intervene on.
So when should you start checking their blood pressure? I have a 1 and a 3-year-old, so...
Perfect. So 3 is usually the age that we start to attempt to check a blood pressure in the office. It doesn't always go well. You know, probably your 3-year-old doesn't like
Sitting
that.
Still.
The hug on the arm, right?
Yeah.
They don't love it. But that's the age that we typically start is age 3. And it's important to differentiate white coat hypertension, which is when the kids are scared, they struggle, they don't want to sit there for it. So sometimes we have to get repeated measures to really understand if a child's blood pressure is normal or if it's of concern.
Do you normally see something like, parents had this issue, so genetically we should be checking the child beforehand because that could be an issue for them?
Yeah, high blood pressure or just essential hypertension, which is high blood pressure for no other underlying cause, does run in families. So when we see kids, especially as they get older with high blood pressure and they have family members with high blood pressure, then that tells us that we need to really make a difference now for that child so that they don't go on to become an adult with high blood pressure.
And what an alarming moment for a parent to be sitting there and going, wow, my toddler has high blood pressure or hypertension. It's such an odd thing to think. What could they do to help at that point?
Right. We usually don't tend to see it really getting high until they're a little bit older. And it's really lifestyle. All the things we talk about for everything else, making sure they get plenty of exercise, maintain a healthy weight, eat healthy foods, get plenty of sleep. Those are the things that are really important, and those are the interventions that we're going to start with when we see high blood pressure.
I tell you, one of the biggest wins as a parent is getting your kids to eat vegetables and healthy. It is a huge win.
If you figure it out, let me know.
I know. And I'll tell you, we're all working on it, right? In other news, scientists, they're looking at dirty air. We just had this whole smog report come out as well, but now scientists are looking at the effect of the air on our kids' health. Their lungs are developing at such a rapid rate when they're little. So what is this doing to their lungs as we live in these dirty cities?
Yeah, this study was really interesting. It's been going on for a really long time, and I was just so surprised when I read it how just diligent the scientists were. They were measuring lung function in kids as they aged, in different areas, and they definitely found a lower lung function in kids who were living in areas or growing up in areas with more pollution. And it sounded like they were looking at certain chemicals that came from mostly burning fossil fuels and looking at the effect on lung function. And it wasn't good. It was pretty concerning. There was definitely a drop in lung function in kids who were growing up around these areas.
So do you have any exact examples? Because I'm just thinking in California, there's not like too many places where we're necessarily in San Diego burning fossil fuels. So, someone's watching right now and they're thinking, well, I need to relocate my family. Don't worry if you live next to the 5. That's not necessarily what we're talking about, but we're talking about like giant factory settings. Is this maybe rural Midwest or?
Well, the study that I was looking at was done in Los Angeles.
Okay.
So, in big cities where you have, areas of smog, that's what they're looking at. We're looking at ozone, and then they were looking at some other things that I can't remember now off the top of my head, but they were looking at the locations where you're going to see more fossil fuels burned. So if you're in a wide open area or suburban area or rural area, you're probably less likely to have this effect. Now, the nice thing is that we do so much now to clean up our environment. We're doing a lot of solar and reusable energy, so hopefully we're going to see that trend go away.
You have a group of moms saying, everyone buy electric cars, please just stop. And gas is so expensive, right?
So it's such a good incentive.
Let's just save our kids' lungs, save our wallets, and figure this all out. If only we all had a lot of money to do that right now. Thank you so much, Dr. Friedman, for coming in. I know we could talk to you forever, so I appreciate it.